Hello, viewers. You are welcome to your show, my show, our show, the Digging Deep Show. Thank you ever so much for tuning into today's program. I'm so excited to have an exceptional man in the studio today. And as you might be aware, the Digging Deep Show launched an awareness 10-week program, Digging Deep to Save Lives, sponsored by the Awards for All. And with me in the studios today is none other than Dr. Chireka. You're welcome, sir, to the studios.
Thank you very much.
Yes, sir. And telling our viewers more, we've lost a lot of brothers, sisters, mothers, even young children due to cardiovascular diseases. And that's why we've invited you today to the program to raise awareness, to let our viewers know more about blood pressure and heart diseases. Can you just tell us more about who you are, what you do, please?
Thank you very much. I feel honored to be invited to this cause, which I do support and welcome it. As I've been introduced, my name is Dr. Dr Chireka. I'm a GP here in the UK. I work in Folkestone, which is in Kent. I'm a local product. I trained in Zimbabwe in 1997 and left Zimbabwe in 2000. And I'm a general practitioner, and my special interest is on patient advocacy. I believe in that any clinical decision that has to be made has to involve patients. They should be at the heart of all decisions. And I believe that clinicians should think through the mind of patient and see things through the mind of patients.
Wow. There's a statement you say which says nothing about patients without patients. And today we are here to raise awareness to our viewers because, like they say, that mainly the majority of the Afro-Caribbeans, they are more at risk of having hypertension, having these heart diseases. And it's a noble cause that we've got people like you coming to the program to raise awareness. Can you just give a brief explanation to our viewers? Tell us, what is this blood pressure?
Yes. I think blood pressure, we all know it as BP. People would say, what you're doing will raise my BP. That's how we talk in Zimbabwe.
Yeah.
So the BP is an abbreviation for blood pressure. But blood pressure on its own is not a problem. Blood pressure just says it's the pressure of your heart when it pumps blood. But what is a problem is a high blood pressure. So when we talk of BP, we forget to say high BP. So high BP, in the medical term, we call it hypertension. This is whereby your blood, your heart is pumping the blood at high pressures. And we do measure this blood pressure by using a machine called blood pressure machine. That machine, it will measure your blood pressure in two figures. We have got two figures. The one on the when it is written, there's one figure on top and one figure on the bottom. For example, 140/90. What does that mean? The one on top is called systolic blood pressure. What does that mean? This is the blood pressure that is measured when your heart is pumping out blood. And then you do have the diastolic blood pressure. This is the blood pressure that is measured when your heart rests in between beats. So those are the two figures. And we do have cutoff points whereby we say what is the recommended. The recommended blood pressure should be below a systolic of 140 and a diastolic of 90.
So anything that goes above 140 for the top one is a cause of concern.
Yes, indeed.
And can we really mention heart diseases without mentioning the blood pressure aspect?
No, we cannot. Blood pressure, we call it a silent killer because it does not have symptoms as such. And people with a high blood pressure will not notice it in the beginning. And we do know that blood pressure causes a lot of problems. For example, it can cause you to have stroke. For example, it can cause you to have a heart attack. It can cause you to have kidney failure. Your kidneys fail to function. Or it can cause your heart to fail as well, because this heart will be pumping against high pressures. It sometimes increases its muscles, and then it will reach a certain stage whereby it will fail. When it has failed, that's when you start seeing people having shortness of breath, even on walking. Even when it gets worse, they can even have shortness of breath on even just sitting down. That's when these things have got worse at that stage.
Wow, we are digging deep to save lives. And asking on the same note, what can people do to prevent this high blood pressure? Because if we've rightly mentioned, is one of the causes of these coronary heart diseases. What can be done to prevent it?
Yeah, there are several things that people can do, but the basic thing is I always ask people, do they know their blood pressure? Anyone who is above 40 years should know their blood pressure. They should have visited their GP, their general practitioner, and get their blood pressure checked. Having known your blood pressure, and then there are things that you need to do to prevent you from getting blood pressure. I know from our community, we like gochi, we like to go for barbecue. Yes. The problem that we face in that is that we do tend to like salt. People do put a lot of salt. And high salt intake has been found to cause high blood pressure. So my message is that if we can reduce our salt intake, that would help us a lot in preventing high blood pressure.
Wow, it's time to cut it down. You know, though it might not be easy, we were groomed taking in a lot of salt.
That's right.
You know, when I go to different places, parties, visit friends, they always say, oh, you guys from the Afro-Caribbean, you tend to take in too much salt. And, you know, sometimes we add that salt on top of the meals. The meal is already done, but we still add more. But like you've rightly educated us that it's time for us to cut the salt down is one of the ways that we can prevent the high blood pressure. Can we say that people that probably their parents, their fathers or their mothers, they've had these heart issues, can they be more at risk of also getting the disease?
The causes of blood pressure, sometimes we don't know what causes it. And then sometimes there are factors that are associated with the cause of this blood pressure. Some people are unfortunate in that it runs in their family, so they will get it. But there are some other things that we can do to make it worse. For example, I've mentioned about salt. The other thing that I need to mention about is that being overweight also causes high blood pressure. And also the other thing that I also need to mention about being inactive. Because if you look in Zimbabwe, sometimes we used to walk, but nowadays with this so-called good living, we are no longer walking.
There's buses everywhere.
Driving everywhere, we hardly walk. And that is another problem. And also the diet, diet which is high in fats is not good for our own health as well. So and also alcohol intake, we need to reduce on that. The other thing is that if we increase our vegetable intake, it would also reduce the risk of us developing blood pressure.
We are getting the education. Make sure you take it to heart. And in case you are just joining us, the Digging Deep show is digging deep to save lives. Here with our Dr Chireka, based in Folkestone, giving us more education. Is it true that black people of African descent or the Afro-Caribbean descent living in Britain, that they are more likely to have high blood pressure and type 2 diabetes?
Yeah, we're finding that the statistics are pointing to that, and there are several reasons for that. That black people, we have found that we've got high numbers of that blood pressure and also diabetes. So this is a cause for concern. And then one would think that, we come from Africa, where we are not used to the Western diet, and we should not be having problems with that. But people tend to forget that when you come here and then you are now eating the Western diet, you are at a much higher risk. Whether We're not sure whether is it because our bodies are not able to tolerate the Western diet. I don't know. It's something that researchers are looking at. It's something that we need to find out what are the causes. But the facts are with us, and we need to act on that. Because the sad thing is that if we don't act on facts, we will die, not because we don't have knowledge, but because we're ignoring knowledge. So the facts are that we are prone to having high blood pressure and diabetes. And the question is, what can we do about it? There is a lot that we can do. It's not end of the world. There's hope out there. We can work together to make sure that your blood pressure is controlled.
Okay, and can you tell us what type 2 diabetes is and how can we prevent or control it?
Diabetes is whereby your body is not able to control the sugar that you get. So you've got a gland in your body which is called the pancreas. It produces a hormone, which is a chemical that helps your body to absorb the sugar that you take. So at times that gland may not be able to produce enough insulin. If it fails to produce that hormone, that condition is called type 1. But if it is not producing enough, then that's part 2. What we know is that if you've got diabetes, your risk of getting heart attack or blood pressure or stroke is very high as compared to someone who does not have it.
Can you tell us how this can affect someone's activities, things like sex or things like them going to work, in terms of the work that they do?
Initially, when someone has got high blood pressure, they may not notice anything. So that is the message that we need to get to people, that don't wait for symptoms. Blood pressure, hypertension, it's a silent killer. So these symptoms that I'm going to talk about are actually symptoms when we have missed the boat, when actually it's end stage. So you may present with a lot of headache, severe headache, constant headache that you may present with. And then the other thing that you may end up having shortness of breath. That's another condition. Some other times you may end up having even having a heart attack or having a stroke. Those are the end stages of high blood pressure. And then when you look at that, how does it affect your activities? If you've got stroke, we know what happens with stroke. With stroke, it paralyzes part of your body. It can paralyze one side, so you can have your left side, left arm, left leg being paralyzed. And then if you don't get rehabilitation quickly, you may be bound in a wheelchair. But people are being rehabilitated to get better if we can control their blood pressure and also reduce other risk factors that can cause them to have a stroke. So these are some of the things that can affect. And then also there is if you are now having shortness of breath, for example, you can't do any exercise, you can't walk, even sexual activities can be affected because
you get tired,
and then you also end up having shortness of breath. So you can't do that. Your quality of life is now affected.
Probably someone's already been diagnosed with a condition. Is it irreversible by any chance?
I would say that this is a condition that can be reversed in the sense that we know that if you are diagnosed with blood pressure, if you lose your weight, if you cut down your fat intake, if you start exercising, you reduce your salt and increase your vegetable intake, you will reduce your blood pressure. You will reduce your risk of a stroke, your risk of heart attack, your risk of heart failure or risk of kidney failure. You will reduce that. So I would say it is reversible. Unfortunately, in some people that have left it too late, then they may present with heart failure or they may present with a stroke. But what I know is that whatever stage you are diagnosed, it's not hopeless. You can do something. Because if you don't do something about it, you will have recurrent strokes and then you will be wheelchair bound. But if you have one stroke and then you take action and you prevent other factors, you may survive without any further problems.
Does hormone replacement therapy prevent heart diseases?
That's a controversial topic. Hormone replacement therapy is whereby women have reached their change when they've reached the menopause, when they no longer have periods. This is a time when their ovaries have stopped producing hormones. And then now they present with symptoms just such as hot flashes, irritability, depressed, or all these other symptoms. And then those symptoms are so severe in some women that they need treatment. And then we can now, there are drugs called hormone replacement therapy that can be given to these women to try and alleviate those symptoms. But the problem is that this medication can cause side effects. So initially people thought that by giving people this medication they would prevent them from having high blood pressure. No, actually these medications have been found to increase your risk of stroke, your risk of getting clots, your risk of getting breast cancer, your risk of getting a womb cancer. So your doctor would sit you down to discuss all these risks, and then you can take it, but after being informed that it can cause you to get stroke, cancer of the breast, cancer of the womb, and also clot in your legs.
We are getting the knowledge in all the questions that has been in our hearts. I know many people have had a lot of questions in their hearts, and some of our viewers are sending questions to us, and especially women. We are up for weight loss. You know, you can do whatever it takes. You can take any pill in order to lose weight. So can you just give us information? Are any diet pills, are they any bad for our heart?
Yeah, I think the basic message that I want everyone to get is that there are no quick fixes when you try to deal with blood pressure. I know we are talking about losing weight, but losing weight the fast way can also be detrimental to your own health. We know that there are so many medications being sold in the internet or in the black market that people are buying. But I have to warn everyone that be careful on what you buy outside. What you need to do, go and see your GP who will discuss with you if there are any medication for you to lose weight. But as far as I'm concerned, we only have got one tablet that we use to make people, to help people reduce their weight. But the mostly is what you can do yourself, looking at what your diet is like and also exercising. And then, of course, there are some people that have tried all this and it's not helping. Then you may need medical intervention to try and reduce your weight. But I'll be saying that there are some medications which we have actually stopped using, which we were using in the past to make people reduce their weight, and they've been found to be detrimental to your heart. So I know that those medications are being sold in the black market or on the internet, and I want to warn people not to buy them and seek medical advice before they take anything.
And tell us briefly, is vitamin E good for the heart?
There are so many theories and people looking at vitamins, looking at certain type of foods, whether they are good for your heart. I would say that most of the vitamins are good for your heart if they are taken in moderation. So sometimes you need to see your doctor, and then they can prescribe whether you need vitamins. But mostly we get all these things in our balanced diet. If you are having fruit, vegetables, enough protein, starch in your diet, you will get all these things that you need. So the supplements, I would be saying, don't take supplements unless at the advice of your GP.
Dr. Chireka, if you can tell us about hypothyroidism, and if you can let us know if it's a risk factor in someone getting high blood pressure or heart diseases. Okay.
Hypothyroidism, which is what is hypothyroidism? Because I need our viewers to understand what we're talking about. We are talking about a gland called thyroid. I think most of us, we know a thyroid gland is here on our neck where I'm touching, and this is what we call goiter. I think you've seen in Zimbabwe, back home, people with protrusion on their necks, which is the goiter. What is a goiter? Goiter is whereby that gland is enlarging due to lack of iodine. And then you may have seen on your salt that is called iodized salt to try and supplement the iodine. But that is, sorry, I've digressed, but I wanted you to understand what is a thyroid. So when we say hypo with an O, hypothyroidism, we are saying that thyroid gland is underactive. So it's an underactive thyroid. It's a thyroid that is not working well. So if it is not working well, it means it's not producing the hormone called thyroxine. That hormone is a chemical that helps your body to function. So if you've got hypothyroidism, you will present with several symptoms, but there are two common symptoms that I want to talk about. One is you feel very, very, very tired, sleepy, and then you'll be presenting with feeling tired all the time. So that's one of the symptoms of hypothyroidism. You can get constipation, you can also get some rashes, you can also have a lot of high cholesterol. So those two things that I want us to focus on is having high cholesterol and feeling tired all the time. These two things will affect your blood pressure. How will they affect your blood pressure? They will affect your blood pressure by one, if you've got cholesterol, the cholesterol will get high and it will block your blood vessels. When your blood vessels are blocked, then it means your blood pressure will go high. The other thing is that when you're not exercising, you're feeling tired all the time, you won't be able to exercise, and then you start putting on weight, and then the risk factors come in, and then you have got high blood pressure. So in short, does underactive thyroid or hypothyroidism affect or contribute to high blood pressure? The answer is yes, and I've explained how it does.
Thank you, doctor, on that. And before we close, there might be some people out there already, they have these conditions. They've got high blood pressure, or probably some don't even know that they've got high blood pressure. Like you say that for us to be able to know, we can only have the symptoms at the later stages, but probably someone is at the early stages, and probably some already know that they have these high blood pressures or they've got heart conditions. So what kind of advice can you give to our viewers who are there with this condition?
Before I go to the advice to those with the condition, I just want to let those that may panic after checking their blood pressure and found that it's above 140/90. We don't diagnose blood pressure on one reading. That's the message that I want people to get. We don't diagnose blood pressure on one reading. We know that blood pressure goes up and down, up and down. So when you check your blood pressure, I would advise you to check it even 3 times. When you're sitting, check it 3 times, relaxing, and then record all the readings. If you find that all the readings are still above 140/90, go and see your GP. The GP will check your blood pressure again, and then they can check it on several times, 2 or 3 occasions. If it remains higher than 140/90, they will diagnose you with high blood pressure. But we have moved a step further. We now carry out what we call ambulatory blood pressure, 24-hour ambulatory blood pressure. What is it? It's whereby we check your blood pressure over 24 hours for a day. So we put a machine and send you home with that machine. That machine will be recording blood pressure every 15 minutes. You carry on doing your life, your activities with that machine, and then it will be recording even when you're sleeping, it will be recording. And then we will have an average of that reading. And then if it is still high, then we diagnose you with having high blood pressure, which is hypertension. Why do we do that? Because we know there are people with what we call white coat hypertension. What is it? It's whereby they come to see us, they're scared, they're worried, they're stressed to seeing a GP, and their blood pressure goes up. But when they go home, their blood pressure is normal. If you treat those people with medication, they will end up falling down, collapsing, feeling dizzy, because you are treating a wrong reading. The abnormal blood pressure is fine, but when they come to see you, they've got high blood pressure. And then if you give them medication, then you are also making their blood pressure, which is low at home, to get even lower, and then resulting in them feeling dizzy and fainting. So we don't do that. We are now much wiser and diagnose true hypertension.
Last words of advice to our viewers out there.
So going further from this, when you are diagnosed with blood pressure, the message that we want to make sure everyone is aware of is that if you are put on treatment, get your blood pressure controlled. It does not save you anything if you are on medication and your blood pressure is not well controlled. The sad thing is that many people out there are not aware that they've got high blood pressure. And even those that know that they've got high blood pressure, the sad thing is that only 1/3 of people that are on medication have got their blood pressure controlled. The other 2/3, their blood pressure is not controlled. So it means those people are just as good as those that are not treated. So I would say when you're on medication, take your medication religiously. Blood pressure cannot be cured. Some people think that when you take medication, you can stop taking medication. But I would say it can be controlled by medication. So stick on to the medication and don't stop taking it. The other thing that there are so many tablets of medication, the dozens of them that you can take for blood pressure. If one does not agree with you, it does not mean that all the medication won't agree with you. Go and see your doctor, explain why you think that medication is not agreeing with you, and you have a fair, frank conversation with your GP. I know there are so many doctors out there in the community who will tell you what problem they've had with their medication, but I would want you to look yourself as a unique person and deal with your problems. Don't deal with what other people have had, because we respond and react to medication in a different way. So I would say take your medication religiously, have your blood pressure checked, and do as your doctor suggests. And have a good relationship with your doctor, and be honest if you're not taking your medication. Be honest if you're failing to exercise or to eat properly.
Thank you so much, Doctor, for these wise words of education. You've really educated our viewers. You've educated myself today, and I hope our viewers are going to take this to heart. Thank you so much, Dr. Chireka, for being with us on the show.
You're welcome.
It was a really privilege to have you on our show today. And to all our viewers, we appreciate you.